The ICU was in chaos, multiple trauma patients, overwhelmed staff, and equipment failures that were turning a busy night into a medical disaster. That's when night custodian Maria Santos revealed why her hands had always been so steady around blood and why she never flinched at the sight of trauma. Because she'd spent 8 years keeping soldiers alive in places where medics weren't supposed to survive. Welcome to Secret Human Stories. Before I tell you this incredible story of hidden expertise and life-saving intervention, tell me in the comments if you or anyone in your family or circle of friends has military service background, and if so, what branch or role they served in. And if you believe stories like this deserve to be told, hit that subscribe button. Because sometimes the most skilled healers are emptying trash bins between crises, waiting for the moment when their training can save lives that hospital protocols can't handle. Maria Santos was everything Metropolitan General Hospital needed in a night custodian. At 35, she was reliable, thorough, and completely invisible to the medical staff who worked around her during the 11 p.m. to 7 a.m. shift. For 3 years, she'd maintained the hospital's cleanliness with quiet efficiency, emptying medical waste, sanitizing equipment, mopping floors, and ensuring that every surface met the strict standards required in critical care environments. The night shift staff appreciated Maria's steady presence and unusual composure around medical emergencies. While other custodial workers would leave patient areas during code blue situations, Maria continued her duties calmly, never showing distress at the sight of blood, trauma, or the intense medical procedures that defined emergency medicine. Her supervisor noted that Maria seemed to anticipate medical needs, often having cleaning supplies ready before messes occurred. The medical staff barely acknowledged Maria's presence, treating her as part of the hospital's invisible infrastructure. To them, she was just another custodial worker, someone who maintained cleanliness while they focused on saving lives. Doctors would discuss cases openly around her, nurses would handle emergencies as she cleaned nearby, and patients would receive treatment while she sanitized equipment in the same room. But there was something about Maria Santos that nobody at Metropolitan General could have imagined. The steady hands that emptied medical waste containers had once performed battlefield surgery, while mortar rounds exploded outside aid stations. The calm demeanor she displayed during medical emergencies had been forged in combat zones, where staying composed under extreme pressure meant the difference between soldiers living or dying. From 2010 to 2018, Staff Sergeant Maria Santos had served as an Army combat medic with the 68th Medical Company, specializing in forward combat casualty care in Afghanistan's most dangerous provinces. For 8 years, she had operated in environments where conventional medical protocols were impossible, and improvised life-saving techniques were the difference between successful missions and catastrophic casualties. Maria's military medical record was exceptional even among combat medics. 267 successful battlefield interventions with a patient survival rate of 94%, including 43 soldiers saved under direct enemy fire. She'd earned the Bronze Star with Valor, 2 Army Commendation Medals, and the Combat Medical Badge. Among infantry units, she was known as someone who could keep wounded soldiers alive in situations where evacuation was impossible, and resources were limited to whatever she carried in her medical pack. But Maria's specialty hadn't been routine battlefield medicine. Her unique expertise was what Army medics call austere environment trauma care, performing advanced life support procedures with minimal equipment in conditions that would overwhelm civilian emergency departments. These situations required medical improvisation, the ability to perform multiple complex procedures simultaneously, and the mental toughness to make life or death decisions while under enemy fire. The psychological demands of combat medicine were extraordinary. Every wounded soldier Maria treated represented someone's son, daughter, spouse, or parent whose survival depended entirely on her skill, judgment, and ability to perform flawlessly under the worst possible conditions. The responsibility was overwhelming, the technical challenges constant, and the emotional cost of losing patients despite heroic efforts had accumulated over 8 years of deployment. Maria's transition out of military service in 2018 had been difficult. PTSD, survivor's guilt from soldiers she couldn't save, and the challenge of finding civilian work that utilized her medical skills without the intense pressure had led her to pursue custodial work at a hospital. The environment felt familiar. Medical equipment, life or death situations, the controlled chaos of emergency medicine. but without the responsibility of making critical decisions that determined whether people lived or died. For 3 years, Maria had successfully convinced herself that her combat medic skills were artifacts of a former life, that the advanced trauma training and life-saving expertise she'd developed were unnecessary in a well-equipped civilian hospital with trained medical professionals. She'd learned to clean around medical procedures without offering input, to witness emergency situations without intervening, and to maintain the invisibility that allowed her to work peacefully in a medical environment. But some skills don't retire, even when the person carrying them tries to suppress them. And on Friday night, January 18th, during what should have been a routine custodial shift, those skills would prove that some knowledge is too valuable to remain hidden when lives are at stake. The night had started normally. Maria was conducting her regular cleaning routine through Metropolitan General's trauma and ICU wings, methodically sanitizing equipment, emptying waste containers, and maintaining the sterile environment that critical care required. The hospital was experiencing typical Friday night volume: motor vehicle accidents, workplace injuries, and the usual medical emergencies that kept urban trauma centers busy but manageable. At 1:43 a.m., everything changed. A mass casualty incident involving a tour bus collision had produced 8 critical trauma victims who were arriving simultaneously at Metropolitan General. The accident had occurred during icy conditions on the interstate, creating multiple vehicle involvement with injuries ranging from severe lacerations to internal organ damage and traumatic brain injuries. Maria was sanitizing equipment in Trauma Bay 3 when she heard the overhead announcements that every hospital worker recognizes as the beginning of a medical crisis. Trauma Team Alpha to emergency. Trauma Team Bravo to emergency. Mass casualty protocol now in effect. All available medical personnel report immediately. Through the Trauma Bay's windows, Maria could see the chaos developing in the emergency department. Ambulances were arriving continuously, paramedics were wheeling in patients with obvious severe injuries, and the medical staff was beginning to show signs of being overwhelmed by the sudden influx of critical cases requiring immediate intervention. Maria's combat medic training activated automatically. 8 years of mass casualty experience had conditioned her to assess overwhelming medical situations and identify the critical points where additional medical expertise could prevent deaths. From her position, she could observe that Metropolitan General was facing exactly the kind of scenario she'd handled routinely in Afghanistan. Too many critical patients, insufficient medical personnel, and time pressure that would determine who lived and who died. The first sign of trouble came when Maria observed Dr. James Thompson, the senior trauma surgeon, beginning to show fatigue after his 3rd consecutive emergency surgery. Dr. Thompson was Metropolitan General's most experienced trauma specialist, but he'd been working for 16 hours straight and was starting to make the minor errors that Maria had learned to recognize as precursors to major mistakes under extreme stress. The second problem was more serious. 2 critical patients were waiting for surgical attention while the available trauma surgeons were occupied with cases that required immediate intervention. The time delays were approaching the critical thresholds that Maria knew from combat experience. The points where delays became deaths, where resource limitations forced impossible triage decisions. The crisis reached its peak when a ventilator failure in the ICU compromised 3 patients simultaneously while the respiratory therapy staff was occupied with trauma victims in the emergency department. Maria watched medical personnel struggling to coordinate manual ventilation, medication management, and equipment repairs while additional critical patients continued arriving. Maria faced a decision she'd hoped never to confront in civilian life. She could continue her custodial duties and watch people die because the hospital's medical capacity was overwhelmed, or she could reveal her combat medic background and use skills she'd spent 3 years trying to forget. The decision point came when Maria observed a 19-year-old male patient, the same age as many soldiers she'd treated, being wheeled into Trauma Bay 2 with obvious signs of internal bleeding and respiratory distress. His vital signs were critical. He needed immediate surgical intervention, but both trauma surgeons were occupied with other cases and wouldn't be available for at least 20 minutes. Maria knew from combat experience that 20 minutes was too long. The patient would die waiting for surgery that she could provide immediately. Maria removed her custodial uniform, thoroughly scrubbed using surgical preparation protocols she'd practiced thousands of times, and approached Dr. Sarah Chen, the emergency department director, as she coordinated the mass casualty response. "Dr. Chen, I'm Staff Sergeant Maria Santos, Army combat medic retired. I can assist with the trauma overload." Dr. Chen looked up from her patient coordination, initially confused by the custodial worker who was speaking medical terminology with unmistakable authority and offering surgical assistance. "I'm sorry, what did you say?" 8 years combat medicine, 267 battlefield saves, trauma surgery under fire. The 19-year-old in Bay 2 has internal bleeding that requires immediate intervention. I can perform the surgery if you'll authorize it. The desperation of their situation overrode Dr. Chen's confusion about their custodian offering to perform trauma surgery. She quickly verified Maria's military medical credentials through the hospital's emergency authorization system, confirmed her expertise, and made the kind of rapid decision that emergency medicine required. "Sergeant Santos, you're authorized to assist. Take Bay 2. Maria moved to the trauma bay with the muscle memory of someone who'd performed emergency surgery under much worse conditions than a well-equipped civilian hospital. The patient, college student David Rodriguez, was unconscious with vital signs indicating massive internal bleeding, likely from liver trauma caused by steering wheel impact during the bus collision. Maria began the surgical procedure that would save David's life, but what amazed the Metropolitan General medical staff wasn't just her technical skill, it was her ability to coordinate multiple medical activities while personally handling complex surgery. "Nurse Patterson, establish bilateral IV access, wide-bore, rapid infusion," Maria commanded while making her initial surgical incision. "Dr. Chen, patient in Bay 4 shows pneumothorax signs, needs chest tube immediately. Bay 6 appears stable, but monitor for shock development." Maria was functioning as both surgeon and trauma coordinator, using skills developed during combat operations where single medics had to manage multiple casualties while personally performing the most critical procedures. Her hands worked with surgical precision while her mind processed the tactical medical situation that could save or lose multiple lives based on resource allocation and timing decisions. The liver repair was complex, Grade 4 laceration requiring delicate suturing to control bleeding while preserving organ function. Under normal circumstances, this procedure would require Maria's complete attention, but combat experience had taught her to perform complex surgery while simultaneously managing broader medical emergencies. "Blood bank type and cross for 6 units. Stat," Maria called while completing vascular repairs. "Patient needs immediate post-op ICU monitoring for liver function and potential complications." Dr. Chen, who had been observing Maria's performance while managing her own critical patient, witnessed surgical technique and emergency coordination at a level she rarely encountered. "Sergeant Santos, your surgical approach is exceptional. Where did you train?" "Forward Surgical Team Afghanistan," Maria replied while closing David's incision. "Mass casualty surgery under combat conditions. This patient is stable, ready for ICU. What's the status on remaining casualties?" The collaboration between Maria and the Metropolitan General Medical Team continued for 6 hours. Maria performed 4 additional trauma surgeries, repairing a ruptured spleen, addressing multiple orthopedic fractures, conducting emergency neurosurgery on a patient with traumatic brain injury, and coordinating the overall medical response using principles developed for battlefield medicine. But Maria's greatest contribution wasn't individual surgical skill. It was her ability to transform chaotic emergency medicine into organized life-saving efficiency. She established triage protocols that prioritized patients based on survival probability and resource requirements, coordinated surgical scheduling to maximize operating room utilization, and provided real-time medical leadership that turned a potential disaster into successful patient outcomes. By 8 a.m., all 8 accident victims had received appropriate medical care, and 7 were expected to make full recoveries. The 8th patient, a 72-year-old woman with massive cardiac trauma, had arrived in a condition that no surgeon could have addressed, but Maria's immediate assessment had allowed medical resources to focus on patients who could be saved. As Maria prepared to resume her custodial duties, Dr. Chen approached her with an offer that would change everything. "Sergeant Santos, what you did tonight saved lives that we would have lost. Your skills, your leadership, your ability to coordinate under extreme pressure, we need that expertise on our medical team." Maria's response reflected the complexity of her transition from military to civilian life. Dr. Chen, I left combat medicine because I needed peace. 8 years of life or death decisions, watching soldiers die despite perfect technique. I needed something without that pressure. But you're a natural leader, an exceptional surgeon. You could train our staff, develop our trauma protocols, help us prepare for situations like tonight. Maria considered the offer, understanding that her choice would determine whether her combat medic skills remained hidden or became part of her civilian identity. After 3 years of trying to forget her military medical training, she realized that some skills were too valuable to waste and some knowledge too important to hide. I'll accept a consulting position, Maria decided. Trauma surgery training, emergency response protocols, mass casualty preparedness, but I want to continue custodial work too. It keeps me grounded. 6 months later, Maria received a letter from David Rodriguez, the college student whose life she'd saved during her first trauma surgery at Metropolitan General. Sergeant Santos, he wrote, I want you to know that I graduated this spring and I'm starting medical school in the fall. You saved my life when you could have just continued emptying trash cans, and now I want to learn to save lives the way you do. David's letter helped Maria understand that her transition from military to civilian life wasn't about abandoning her medical skills. It was about using them in ways that created healing rather than just preventing death, hope rather than just survival. Today, Maria Santos works at Metropolitan General Hospital in a dual role that combines custodial duties with trauma surgery training and emergency response consultation. She still maintains the hospital's cleanliness standards, but she also develops medical protocols, trains surgical teams in combat casualty care techniques, and serves as the institution's expert on mass casualty response. The medical staff at Metropolitan General now understand exactly who Maria is and what she's capable of. They respect her choice to maintain custodial responsibilities alongside her medical consultation work, and they appreciate having someone whose combat experience provides perspectives on trauma care that civilian medical training cannot replicate. Maria's story teaches us that military medical skills don't disappear when uniforms come off. They wait for moments when civilian medical systems need the kind of expertise that only combat medicine can provide. The combat medic who once saved soldiers' lives in Afghan aid stations found a way to continue that mission in a civilian hospital, using her knowledge to improve trauma care while maintaining the peaceful routine that helped her process years of high-stress military service. Sometimes healing comes from performing surgery under enemy fire in combat zones. Sometimes it comes from maintaining the clean, sterile environment where civilian healing can occur. Sometimes it comes from stepping forward during medical disasters to provide the leadership and expertise that prevents tragedy. Maria Santos learned to provide all 3 forms of medical service. The night custodian, who used to be a combat medic, became the night custodian who still saves lives when hospital systems are overwhelmed, and additional medical expertise can mean the difference between patients living or dying. Her hands never forgot how to heal, whether they were holding surgical instruments or cleaning supplies. Maria Santos proved that military service doesn't end with discharge. It evolves into new forms of community service that utilize hard-earned skills to benefit civilian populations in ways that honor both military training and the desire for peaceful civilian life.